We are doing our presentation on diabetic emergencies. Diabetes mellitus, or better known as diabetes, is the condition in which the body does not produce enough insulin or does not use insulin effectively. There are two types of diabetes. Type 1, also known as insulin-dependent diabetes, is when the body produces little or no insulin. In type 2, the body produces insulin, but either the cells do not use the insulin effectively or not enough insulin is produced. People who have type 2 diabetes can sometimes regulate their blood glucose levels sufficiently through diet and do not require insulin injections.
When type 2 diabetes cannot be controlled with diet and exercise, two problems can occur. Either there is too much or too little sugar in the blood. This imbalance of sugar and insulin in the blood can cause illness. Hyperglycemia is a condition in which too much sugar is in the bloodstream and the insulin level in the body is too low. In this condition, body cells become starved for sugar. The body attempts to meet its need for energy by using other stored food and energy sources such as fats. However, converting fat to energy is less efficient, produces waste products, and increases the acidity level in the blood, causing a condition called diabetic ketoacidosis. If this condition is not treated promptly, diabetic coma, which is a life-threatening emergency, can occur. On the other hand, when the insulin level in the body is too high, the person has a low blood sugar level. The blood sugar level can become too low if the diabetic takes too much insulin, fails to eat adequately, or due to sudden illness, cannot keep food or liquids down, overexercises and burns off sugar faster than normal, or experiences great emotional stress. In this situation, sugar is used up rapidly, so not enough sugar is available for the brain to function properly. If left untreated, hypoglycemia may result in a life-threatening condition called insulin shock.
The most common signals for diabetic emergencies are the same and include changes in level of consciousness, including dizziness, drowsiness, and confusion, irregular breathing, abnormal pulse, either rapid or weak, and feeling or looking ill. For hyperglycemic conditions, the signals include the victim having flushed, hot, dry skin and a sweet, fruity breath odor that can be mistaken for the smell of alcohol. The person might also appear to be restless or agitated. It is not important for you to differentiate between hyper and hypoglycemic because the basic care for both are the same. To care for diabetic emergencies, first check and care for any life-threatening conditions. If the victim is conscious, check for non-life-threatening conditions by looking for anything visibly wrong. Ask if he or she has diabetes or look for a medical alert tag. If the victim tells you that he or she is diabetic and exhibits the signals above, then suspect a diabetic emergency. If the conscious victim can take food or fluids, give him or her sugar. Most candy, fruit juices, and non-diet soft drinks contain enough sugar to begin the reverse hypoglycemia. Common table sugars, either dry or dissolved in a glass of water, also works well to return the victim's blood sugar to an acceptable level. If the victim's problem is low blood sugar, the sugar you give him will help quickly. If the victim's blood sugar level is already too high, the additional sugar will do no further harm. Often a person who has diabetes will know what's wrong and will ask for something with sugar in it. He or she may carry a readily available source of sugar for such situations. If the victim is conscious but does not feel better approximately 5 minutes after taking sugar, call 911 or the local emergency number immediately. If the victim is unconscious, call 911 or the local emergency number immediately. Do not give the victim anything by mouth. Instead, monitor signs of life and breathing and keep him or her from getting chilled or overheated.